a time when people have been standing at their doorsteps and clapping NHS staff, we believe we also need to stop and give ourselves a clap and be proud of all we have achieved and take a moment to celebrate and share the ways that all of us as OHP practices have shown resilience, innovation, agility and teamwork when responding to one of the greatest public health challenges in NHS's history.
During COVID, there was lots of daily government guidance about things like PPE and consultations, which needed to be shared with practices. We established a COVID committee to summarise and share the information, which meant everyone was kept up to date across the whole partnership.
We struggled to keep everybody at Ridgeacre up to speed with all the changes, so we borrowed a teleconference number. Now we're doing it on Teams, which is even better, and started meeting with the whole team every day for 15 minutes. Everybody knows what's happening and everybody can chip in their ideas, so what we decide, we know we're getting right for patients.
When COVID started, we decided that we needed to combine the efforts of the community hospital, the care homes, and our lovely volunteers in the community. As a result of this coordinated effort between all of us, we have managed to keep the virus levels in our community low so far.
We needed a way to see housebound patients safely, so we introduced a new home visiting service for OHP practices across Birmingham Solihull. This coordinated PPE, Sancton ambulance and enterprise drivers, allowing clinicians to visit a wider area more easily. This meant vulnerable patients could still access vital primary care services.
I have been volunteering throughout the pandemic for our health partnership, delivering PPE equipment and other equipment provided by our health partnership to doctors' surgeries and health centres throughout the Birmingham area. I have also took blood pressure equipment to people's houses for them to use and return back to the surgery. I have found this very satisfying and I hope my contribution to our health partnership has been useful.
Overnight, the way we dealt with patient consultations had to change. No more face-to-face. We transformed the provision to telephone and video. Recently, we have moved to online consultations in a bid to further improve access and maintain staff wellbeing. It's saving time for patients and GPs, and it sets us up for a multidisciplinary team approach to delivering care.
We wanted to help keep our patients and staff safe by reducing unnecessary trips to the surgery. We contacted all patients who were not set up for the electronic prescription service and nominated their chosen pharmacy. We've been able to register almost 100% of our patients with EPS. We are now also using electronic repeat dispensing where appropriate. We have received positive feedback from our staff and patients regarding this.
We needed somewhere to see patients who are symptomatic, so we set up Amber Hubs in repurposed GP surgeries. We pulled together PPE, IT, OHP support and colleague collaboration, and we kept staff and patients safe.
We needed to be able to manage prescribing remotely. We utilised existing extended access facilities and worked with GP IT system capability to support our practices. This achieved paper-free management of prescribing without any interruptions in service to patients.
We were particularly worried about our shielded patients, so we set up a hotline within days. They were answering phone calls for help, for shopping and for prescription collections. The group is called Pulling Together Ludlow, and so far they have answered more than 1,000 calls for help.
At our practice, we wanted to maintain face-to-face mum and baby checks. We assigned a room to these appointments, removing unnecessary items to facilitate cleaning. We call mums the day before to explain how things will run. We have found that this has streamlined our process and helped reduce DNAs.
We were concerned about our vulnerable patient groups, so we contacted our shielding list regularly and worked closely with our social prescribing team and referred patients as appropriate. We continue to offer learning disability checks and chronic disease reviews via the phone where appropriate. This has given both staff and patients peace of mind.
We know our most vulnerable patients will be asked to pause their period of shielding from the 1st of August. So we are planning to offer dedicated nurse-led clinics once a week to cover the essential face-to-face healthcare needs of our patients that cannot be delivered remotely. The surgery will be closed during this time, with access restricted to those deemed high risk.
At the start of the pandemic, we learned that our elderly poorly patients wanted to die in the community. We contacted them proactively to ensure that the respect forms were in place. This meant that we were able to support them during their final days as per their wishes with the loved ones around them.
So at the beginning of COVID-19, they developed some anxiety among the team. So we decided to create a practice WhatsApp group, and this helped to communicate everything to all the staff, as well as weekly Zoom calls for the reception team. This helped to alleviate any fears and anxiety that they had.
Over the last few months, we've supported staff that have been shielding and working from home. OHP have been a real help, providing them with laptops, keyboards and webcams. Partners and staff working at home have joined the virtual lunchtime meeting via Microsoft Teams. We have found this a great way to communicate and kept staff morale high.
Everyone at Ridgeacre was really anxious at the beginning. I described my own emotional wobbles in a video clip that I shared with the team, and I was struck by how well that was received and opened the door to let colleagues share their own worries too. It really seemed to take down everybody's stress levels.
We were conscious that COVID would challenge our resilience personally and as a practice. To promote wellbeing, we've had an amusing weekly update from Shield and GP, held an online pub quiz, and actively encouraged self-care. This has helped to reduce stress levels and provided a good team bonding experience outside of the formal workplace.
Clinicians are finding that during the pandemic, they were struggling with car keys and sharp boxes, etc., as well as donning and doffing PPE and cleaning the room in between patients. We developed a clinician's buddy from our enthusiastic reception team as a helper. The result was a more efficient and face-to-face service to our patients.
Realising I had to stay at home and shield during the pandemic was quite hard to take on an emotional level as much as anything else. Thankfully, OHP supported me with a laptop and my colleagues have kept in touch. I've maintained contact with all the staff, telling them tales about my animals and attempts to continue my sports training in lockdown.
It's our duty of care and my role to keep all staff safe in the workplace. During COVID, as well as social distancing, all our staff complete a daily risk assessment, asking if they are experiencing any of the COVID symptoms. By doing this, it reassures our staff knowing our workplace is safe to work in.
So just as it happened, our senior nurse Debbie was retiring midway through the height of lockdown, and we couldn't have a party. So each team member made a short video saying goodbye, and now Debbie has a permanent memento of how much she means to us. It's actually her favourite present.
We are working hard, it's still busy, and it's an ever-changing landscape. But let's not forget to reflect and celebrate these moments and recognize how they will influence the way we work and support our patients going forward.